Good evening, all. I'll be presenting coincidental ocular anomalies found in telescreening of retinopathy of prematurity conducted during the COVID pandemic. So, ROP telescreening is an essential newborn service by Government of India under Rashtriya Bal Swasthya Karyakram. Despite shortage of ROP specialists, telemedicine-based outreach screening ROP program is well established with the help of wide field camera-based digital imaging in suburban and rural neonatal care units. There are studies showing usage of digital fundus imaging to assess non-ROP ocular anomalies. These were the studies of Jayadev et al., Liu et al., and Ranjan et al. So COVID-19 pandemic disrupted the ophthalmic care and ROP screening across the country due to the cessation of public transport and other restrictions. In this study, we report the magnitude and spectrum of non-ROP findings, including referral warranted ocular pathologies detected during ROP telescreening program from January 2020 to December 2021. So it's a retrospective study where ROP telescreening was done in neonatal care units of Kerala and Tamil Nadu in children with gestational age of less than 36 weeks and birth weight less than 2 kgs. Babies born after 36 weeks were also screened if requested by neonatologist. Images were obtained according to ROP telescreening protocol, one dilated anterior segment image and at least 5 fundus images covering posterior port and 4 quadrants were obtained by well-trained technicians with the help of RedCam shuttle. So total 10,670 sessions were carried out, 4,718 babies were screened, 264 eyes of 140 babies had non-ROP findings and 20.7% among them had referral warranted pathologies. So out of 2.9% of babies had non-ROP finding, 10% were unilateral, 90% were bilateral, 92.1% had posterior segment pathology and 7.8% had anterior segment pathology. 20.7% had referral warranted pathologies, 48.2% children had hospital-based evaluation. Surgical intervention was done in 2 babies and 3 babies were managed medically and 3 babies were managed with visual rehabilitation. So total 158 eyes of 129 babies had posterior segment pathologies. Among them, hemorrhages was the most common finding. 2 babies had intraocular mass, 4 babies had posterior uveitis, and 1 baby had endogenous endophthalmitis. Hemorrhages was the most common finding, and none of the baby in our study had significant hematological abnormality. Most of the hemorrhages were self-resolving. Dense vitreous hemorrhages or premacular hemorrhages were referred to higher center for further management. 4 babies were referred. 2 of them came for follow-up. As the hemorrhages were resolving, nil intervention was done. There were 5 babies who were suspected case of posterior uveitis. 1 of them was diagnosed as a case of endogenous endophthalmitis and was treated under the supervision of neonatologist. Other 4 babies consulted a nearby private hospital. 2 babies were diagnosed as a case of retinoblastoma and treated with intravenous chemotherapy and transpupillary thermotherapy. Presently, they are on follow-up at base hospital. It is the second most common ocular finding which required immediate referral and management. Other posterior segment findings included retinochoroidal coloboma and albinotic fundus. Total 18 eyes of 12 babies had anterior segment pathologies. Most common was congenital cataract. 1 baby had microcornea, 3 had corneal opacity, 1 with iris coloboma, and 1 baby had microphthalmos. So congenital cataract was the most common non-ROP finding which required referral and surgical intervention similar to many other studies. Hospital-based evaluation showed visually significant cataract in 57%. 3 babies were lost to follow-up. Cataract surgery was performed in 2 babies and 2 babies failed to follow up for surgery. There were 5 cases of congenital corneal opacity. 1 of them was a case of Peters anomaly. The baby was started on anti-glaucoma medication and is being followed up regularly. Coming on to discussion, telescreening program has enabled digital imaging of both anterior and posterior segments, early detection of pathology, successful cross-consultation, and appropriate management of multiple diseases by relevant specialists. So this is a table showing incidence of non-ROP findings in our study versus other study. In our study, it was 2.96% in 2 years. In Ranjan et al. Study, it was 4.2% in 4.5 years. In Jayadev et al. Study, it was 7.6% in 1 year. So during COVID pandemic, many babies were lost to follow-up and probably took treatment at another center closer to home. So despite being retrospective, this is one of the few studies to screen non-ROP ocular finding during the COVID pandemic. Thus, I conclude, with the help of telescreening, we can diagnose sight-threatening as well as life-threatening pathologies. Based on the results of our study, we strongly opine to screen non-ROP pathologies along with ROP screening, irrespective of the gestational age of the baby. Since the visual symptoms in babies would only be identified later in life due to their inability to express, telescreening should be adopted as a part of routine neonatal care. Thank you.
One or two things I want to clarify. So, which setup? If you do a screening in a NICU setup, NICU setup,
Yes,
or a general babies setup. So the
NICU.
finding. So this study was done in a NICU setup.
NICU setup in Kerala and Tamil Nadu hospitals.
Oh, all NICUs, all the babies. Okay, fine. So, what was different about pandemic? Like, why you're referring to as a pandemic associated?
Because not associated, ma'am. We just noticed that the follow-up rate was very less. Like cataract surgery, also there were 7 babies with cataract. We could only get 4 babies for follow-up in hospital, and out of them also only 2 babies underwent surgery. So follow-up was the problem. One thing. Other thing is telescreening that time was reduced because of the COVID restriction, because of the risk of infection transmission. So those were the 2 points which were
But
different.
still, during the pandemic, screening were being
Screening
done.
was there, ma'am, but
Screening
it
was
less.
being
It
done
was less.
because all NICUs had preterm babies and they had to be screened. So nothing special during that time. I think all the babies who needed screening, they had to be screened at any cost. Okay, so these are the findings which you normally have in a NICU setup. But if you have a broad population screening, then you won't see. So you should mention whether the screening was a NICU based screening, because the findings will differ. Okay,
Yeah.
if it is a hospital based screening or a general baby screening.
Thank you.
Just one question. This was published in Ophthalmic Clinics 2020.
Yes.
Fair enough.